So today we are going to look at the pathophysiology of diabetes. Okay, so let's look at the key players in diabetes, because if you understand what happens normally in the body, you will also understand why diabetic patients have all these health problems. So the big key players in diabetes is glucose, insulin, glycogen, and the liver. So all of these work together to help your body use glucose. Now, the big issue with diabetes is insulin. I will explain why insulin is an issue. I'll explain that in a second. But first, let's focus on glucose. Yes, let's focus on glucose for a bit. So what is glucose? So glucose is sugar, obviously, and your body needs it to survive. And what glucose does is that it enters into the cells and activates those cells so that they can work. But the thing is that glucose cannot enter into the cells without the help of insulin. So when you eat sugar or eat food containing sugar, it will enter your blood. But for it to actually go into your cells and your cells to use it, it has to have the help of insulin. And if you don't have any insulin in your body, then your body is not going to have the ability to use the glucose. And the glucose is just going to stay there in the blood and cause high blood sugar. Now, let me explain why insulin is an issue. Okay, so what is insulin? So, insulin is a hormone. It plays a huge role in helping us lower the blood sugar levels. It regulates the amount of glucose in the body. So now, the question is, where does insulin come from in the body? So insulin is secreted by the pancreas. It is formed in the beta cells of the islet of Langerhans. So if this area is damaged, then you are in trouble, because you are not going to have any insulin production. So your body will have no insulin. Now, the thing with insulin is that it acts like a key to let glucose pass from the blood into the cells to produce energy. So when glucose enters the blood, the pancreas will respond by making insulin and release it. Okay, so now let's talk about glucagon. So glucagon works in the opposite of insulin. Insulin helps us to bring our sugar levels down. Glucagon helps us to increase our sugar levels. So what the liver does in this case is that if you have extra glucose in the body, the liver will take it and store it and then turn it into glycogen. So now the difference between glucagon and glycogen is that glucagon is a hormone. It increases our sugar levels, while glycogen is a storage for glucose in the liver. So when the sugar levels drops, the pancreas releases a hormone known as glucagon. It will signal the liver that the sugar levels are low. So the liver will release glucose from glycogen, which is the storage of glucose. The liver is very sensitive to insulin in the body. So whenever it senses that you have too high of insulin levels in your body, it will release glucose from glycogen. But if you have low insulin levels and low sugar levels, it also helps. So now, I want you to understand this part. Whenever you have high blood sugar and high insulin levels, the liver will cause the body to absorb that extra glucose and turn it into glycogen so that you can use it later. Okay, so let's look at the classifications of diabetes. All right, so how are we going to classify diabetes? So there is type 1 diabetes, which is also known as insulin dependent. So patients with type 1 diabetes, they don't have any insulin production. So with type 1 diabetes, what normally happens is that you may eat sugar or eat a lot of food containing sugar, but the sugar will just stay there in the blood because there is no insulin to help glucose enter the cells. So this may happen due to damaged beta cells of islet of Langerhans of the pancreas, where insulin is produced. So this can lead to no insulin production or little production of insulin. So apart from that, we have type 2 diabetes. So type 2 diabetes, what happens is that the body is secreting insulin perfectly, but the cells are resisting it, not responding to it. So it can also be that the pancreas is producing less insulin. So this will lead to high blood sugar levels. So the third one, we have gestational diabetes. So what happens with gestational diabetes is that during pregnancy, the placenta produces hormones that cause insulin resistance, making it difficult for the body to use insulin effectively. And the pancreas cannot produce enough insulin to overcome this resistance. So this will also lead to high blood sugar levels. Yes,